first time in U.S. history, older adults are expected to outnumber children by 2034. As our population ages, we are facing growing healthcare workforce shortages. I've dealt with that before I came to the Senate in a different arena. Indiana has 4,300 job openings for nurses and is projected to need 5,000 more by 2031. Nursing homes have not been spared from these shortages, leading to issues with patient care and overall quality. My home state has worked to address this issue. A law championed by Ivy Tech Community College and the Indiana Hospital Association removed limits on nursing school enrollment. Ivy Tech partnered with nursing homes to offer paid apprenticeships. Last month, I went to a rural high school, and they have a program for students to earn a CNA. We need to do a lot more of that in high school, where the education is the best value we get, and before they get outside of the system, we need to have programs there, career and technical education, that lead you into places that may not need more time and more money. I've also introduced the Prioritizing Evidence for Workforce Development Act, which prioritizes funding for evidence-based workforce programs. The federal government should make it easier for people who are looking to work, not more complicated, especially in healthcare. Instead, excessive federal rules and regulations pose barriers. We got to have regulations, some guardrails, but not to where they become oppressive. And I've witnessed that in running a business over the years and being aligned with a state government that I think finds a little better balance. President Biden is expected to propose an overtime rule, for instance. In my own company, that was $35,000 at one point. I think it was adjusted up a little bit, but taking it up to $80,000, that will dislocate so many jobs in the people that would want something at a lower level, but you got a kind of a crazy federal recommendation there, and that is what goes above and beyond. This would make nursing home workers subject to overtime regulations, reducing staff flexibility and quality of care. As an employer, I dealt with the Obama administration's overtime rule myself, and know the obstacles it created in my own business. As we work to build up healthcare workforce, we must do more to improve transparency and accountability. 2021, we spent $181 billion on nursing home care. However, nursing home cost data is not readily available. Transparency is lacked in so many places in commerce throughout our country, and a lot of it has to do with government regulations, or at least their being for it. More transparency is never bad. Sent a letter to the National Center for Health Statistics asking to improve an important long-term care survey that runs every 2 years. Currently, the survey does not ask about nursing home costs. So I've asked to add new questions to that to bring that out into the forefront. Federal government is required to conduct annual surveys of nursing homes, which is vital. It just needs to be done, I think, more thoroughly and with full transparency. CMS incorporates survey data in developing 5-star quality ratings, which are displayed on the website Care Compare. I am developing a bill that would make Care Compare more accessible. I'd like to recognize the majority's report. Think there for that as well. Over the past 2 years, nursing home inspection rates have been unacceptable. COVID policies contributed to some of these delays. Nevertheless, we got to do better. So much of healthcare comes at that stage in life. I agree with some of the recommendations in the majority report. We need to improve Care Compare and expand the healthcare workforce. I look forward to working with the chairman to accomplish these goals.